Okay, so should we make a start? Yeah. Okay, so good morning, good afternoon, good evening, everyone. So welcome to the COVID-19 Behaviour Change Forum webinar series. So hope you had all a good festive break and set for the new year. So happy new year, everyone. So today's session, we are going to be having a session on building trust in public health measures during the COVID-19 pandemic. So really excited to be here today. So we've got a couple of speakers who will be discussing their formative research, which is conducted in a couple of countries in building trust during the COVID-19 pandemic. So in today's webinar, we're going to have an introduction and an overview from Ricardo. So he's a program director within the Peace and Recovery team at the Innovations Poverty Action. We've then got a couple of colleagues. So we've got Kate Vyborny, who's a research scientist and associate director at the DevLab at Duke University, who will be giving a bit of an overview of some insightful insights from religious leaders in Pakistan. Then we've got Travis Curtis, who's an assistant professor at Drexel University, who will be giving an insight from Uganda in public trust and policing and the COVID-19 pandemic. And then what we're going to do is we're going to have an open session for dialogue with the attendees. So to discuss and question and answer some questions around development and maintaining that public trust, maybe hear from experiences in the field, like what successes and challenges, and moreover, what learnings can we extrapolate for future policies and programming in future disease outbreaks. Okay. So the broad aim of the session is to provide a brief overview why building trust is important, is to hear how two research studies that were conducted in Pakistan and Uganda have embarked on unpacking trust. And like I mentioned before, the questions will discuss the successes and challenges, and moreover, what learnings we can draw from for future disease outbreaks. So we're seeing, COVID-19, but we're also seeing other emerging diseases which are causing us concern, such as the global outbreaks of cholera, but also Ebola and Mpox and so forth. Okay. So Ricardo, over to you. I'm going to stop sharing just now. So over to you, Ricardo.
Thank you, Jenny. And yeah, it's a pleasure to be here. And thank you everyone who is giving their time to join and listen to these presentations. My name is Ricardo Morel, and as Jenny mentioned, I'm the director of the Peace and Recovery Program at Innovations for Poverty Action, or IPA. I'll start giving you just a brief introduction about how this research came about and what's the role of IPA in this, and then jumping in to give a brief introduction about why we're focusing on trust in this webinar. So the Peace and Recovery Program is hosted at IPA. It's part of the broader Governance, Crime and Conflict Initiative, which is an investment by the FCDO to support rigorous research and policy-relevant research to determine what works, what doesn't work, on topics related to improving governance, to overcoming crime and violence, and also responding to humanitarian crises in low and middle income countries. And this includes, of course, pandemics. And therefore, we have supported rigorous research studies on the effectiveness of COVID-19 responses. Two of the studies which we have supported will be presented today by Travis and Kate. And just to take a step back, this initiative, the Governance, Crime and Violence and Conflict Initiative, is led by two organizations. One of them is IPA, who I represent. The other one is the Poverty Action Lab based at MIT, also known as JPAL. So IPA and JPAL have been collaborating for about 2 decades on ensuring that policy is informed by scientific and rigorous evidence. And we have overall, in different sectors, supported more than 1,000 impact evaluation studies. You could say randomized evaluations in over 80 countries. When we are referring just to the Governance, Crime and Conflict Initiative, IPA and JPAL have supported since 2017, when the initiative started, about 110 studies. This includes RCTs, but also quasi-experimental and panel surveys in nearly 40 countries. So yeah, we really appreciate the support that FCDO is giving to generate this rigorous evidence on these topics. The aim of why we are supporting this type of research is to answer fundamental questions on these topics and hopefully providing generalizable insights to inform programming and policy in different contexts. So not just in the countries where we are running the research, but we want that these insights can be extrapolated to different contexts as well. And this is why we are inviting today two researchers that have worked in two particular countries, but I think they will give us insights and recommendations on how this could also potentially be generalizable to other contexts. So, as you know, today we're discussing building trust during the COVID-19 pandemic. So the two studies we'll be presenting today come from Pakistan and Uganda. And as I mentioned before, we hope that the findings and recommendations can inform policy in different contexts. But why focus on trust? No? Why do we think it's important during a pandemic? And of course, if you read the papers we're going to present today, you will have a good understanding of why this is important. But just to recap and make a quick introduction before handing over to the other speakers, trust is key in these situations because it's important to ensure that citizens comply and follow guidelines and protocols during a health crisis. And these guidelines and protocols, of course, are trying to control and mitigate the negative effects of a health crisis. And this is especially, of course, relevant during a pandemic where restrictions can be very costly and disruptive for citizens. As we saw during the COVID-19 pandemic, there were some countries imposed more strict guidelines than others, and the responses of the citizens were different across countries and even different within the same country, depending on the level of trust that the citizens had in the agencies that were making these recommendations or these imposing these restrictions. So there are many actors that play different roles during a pandemic response, as you all know. Like we have public health authorities trying to identify the health risks. We have then public officials trying to define regulations. We have local leaders, be it religious leaders, civil society leaders, that are disseminating information about these guidelines. And we also have law enforcement agencies like the police, which is related to one of the studies that will be presented today, that are trying to ensure that these restrictions are being followed. So, as I mentioned before, citizens will have different levels of trust depending on these different actors. And they can even have different levels of trust toward the same actor at different points in a pandemic, if it's protracted especially. So they are very important and relevant questions about how to build trust. And the research that we're going to be sharing today is trying to tackle some of these questions. And of course, there's more research that needs to be done, but I think we will have very interesting insights about questions such as, for instance, like which authorities or which leaders are most effective in convincing or persuading citizens to change their behavior towards following particular rules and recommendations. No? And when we talk about these authorities or leaders, we can even break it down further, like, for instance, like related to one of the papers, like are religious leaders more effective in giving messages than civil society leaders, for instance, or elected political officials? Or if we look at different administration levels, like are local leaders or authorities more persuasive than national government or even international actors? We can even look at like the community itself. Is it more important to have trust in the community members rather than a different agency? Could be the police, for instance. So yeah, we'll try to tackle some of these questions during the presentations today. So I hope you enjoy and we all learn more about why it's important to build trust during a pandemic. So I'll hand it over to you, Travis.
Great, thank you so much, Ricardo. I'm gonna wait for Jenny to share the slides, and then I'll go ahead and get started. Okay, and so I'll go ahead and just get started. Thank you so much for the invitation to join the session and the opportunity to present some of my research. And so today I'm going to be talking about public trust in policing and the COVID-19 pandemic. This is joint work with Robert Blair at Brown University, David Dow at the University of Arizona, and Guy Grossman at the University of Pennsylvania. My name is Travis Curtis. I'm an assistant professor at Drexel University here in Philadelphia, Pennsylvania. So good afternoon to you. Good morning here. We're just getting our day started. So this project is a part of a broader community policing study that was taking place in Uganda, and I'll talk a bit more about kind of the infrastructure that was in place for the study when it was started. But if we go to the next slide, I want to begin by just thanking the generous support of the Foreign Commonwealth Development Office and JPEL's Crime and Violence Initiative. If it wasn't for this support, this study would not have been possible. And so, like many of us, when the pandemic hit, several of our plans were changed. We kind of looked with horror at the new reality that was life under COVID, but there was also opportunities to kind of perhaps ask questions that we hadn't considered before, or consider linkages between dynamics and political phenomena, like something like public perceptions of the police and how we might think about public health. And so in the early stages of COVID, Guy Grossman kind of reached out to me and David Dow and talked about how there may be this opportunity to build off of their community policing study to consider how people might be viewing kind of the Ugandan government's response to the crisis. And what I want to say is that without the support from the office and JPEL, this study would not have been possible. And so just thank you for that generous support. So next slide. So our study reports results from a large panel survey conducted before and during the COVID-19 pandemic in Uganda. And so as I just mentioned, one of the benefits of this study is that we were able to build off of an infrastructure that was already in place. And so we were able to gather and build on survey data that we had gathered prior to the pandemic outbreak, and then was also another round that occurred during the pandemic. And in this study, we provide a novel argument for why trust is important, not just trust in general, but at 4 specific stages of the pandemic response, which I'll get into in just a moment. And in our article, we show that messages from government officials generate stronger support for public health restrictions than other actors, and I'll break down why that's important in just a moment as well. We show that compliance with these restrictions is positively correlated with trust in government, and perhaps surprisingly, we demonstrate that the relationship between trust and compliance is especially strong for people's trust in the police. And so there's something really important, especially in contexts like Uganda, where individuals need to be able to trust those who are actually enforcing the regulations relating to the public health crisis. So next slide. So the motivation for this study is that existing work has highlighted, as Ricardo just mentioned, the importance of trust in government in shaping people's response to public health crises. Often public health regulations are extremely disruptive to people's lives. They're often extremely costly to follow. And so there has to be some reason why people are willing to change their behavior in order to follow those regulations. And existing studies coming out of Liberia and other contexts looking at Ebola, cholera, and other kind of pandemics have actually highlighted how important trust in the government is. However, many of these studies focus on broad measures of trust in government. It's just kind of trust in the government in general, rather than what is it actually about the government that they're trusting. And so while we think that these previous studies are very important, we actually think that it's important for us to actually begin to kind of disaggregate what does trust mean, and trust in which government actors. And as we know, and as Ricardo also mentioned, various government and non-government actors are responsible for responding to different aspects of public health crises. It's not like it's just one actor or one institution, or that it's just the government as a whole, but it's actually a myriad of different actors within the government and outside of the government who are responding to these crises. And what we argue, what we believe motivating this study, is that people's perceptions of these various actors and their trust in them are likely to vary. And so we need to not just think about people's trust in the government in general, but actually within specific actors and agencies. And so that's the kind of setup and motivation for our study. And next slide. Sorry. And so that leads to our two primary research questions. So our first question is, which authorities might be most effective at actually persuading citizens to accept costly and disruptive restrictions on their behavior during public health emergencies? Is it actually messages from the government as an authority, or is it messages from religious leaders or traditional leaders, or messages perhaps from an international NGO? Where might messages actually lead people to change the most? And so we think that that's an important first question to answer. And second, and relatedly, of the varieties of trust in these various government and non-government actors, which is most important in actually generating actual compliance with public health restrictions? And so these are kind of interrelated questions, but these are questions that we wanted to seek to answer in this study. And so in order to do that, we set up our research design. But first, we wanted to lay out why it's important to answer these questions, which is focusing on our argument that we should actually look at not just a response as a whole or trust as a whole, but actually break these down so that we can actually see perhaps where the strength and the weaknesses might be in the way that people perceive and view these various institutions. And so in this study, we actually lay out 4 stages of pandemic response. We argue that it's important for us to think about each one of these stages and how people might trust the various actors responsible for implementing them. And so first, we can think about diagnosis. And so public health officials, international NGOs, and others must diagnose the causes and transmission pathways of a new public health threat. And we witnessed that in the early stages of the COVID-19 pandemic. Next, in response to those threats, the governments have to set up regulations. And so government officials must pass new regulations to actually contain those threats. And so that may be the central government working in concert with other international actors to kind of regulate the spread. Next, actors, government and non-government actors must promulgate information, and so they share information about the various risks. And this can be a variety of state and non-state actors, including government officials, religious authorities, as Kate will talk about in Pakistan in just a moment, local civil society leaders, and the media must again work in concert to actually share information about the threat and make sure that the citizens are aware of what's occurring. And then, especially related to this study, government and non-government actors must actually enforce those regulations in order to ensure that citizens are complying. And what we actually highlighted in Uganda, and as Ricardo mentioned, this isn't just a study about Uganda, this actually happened throughout several countries, is that states pivoted to law enforcement agencies, specifically the police, to actually enforce these regulations, which again highlighted the important link between policing and public health and the way that people actually perceive police in society. And so in order to kind of walk through our theory, we used an original panel survey conducted again both before and after the pandemic in Uganda. Our sample includes 2,587 respondents in just shy of 300 villages. We spanned 13 districts in all 4 regions of Uganda. We selected these districts in coordination with the government to ensure equal representation of Uganda's 4 main regions. And this, again, as I mentioned earlier, builds off of a previous study, a community policing study that was already taking place in Uganda. So this allows our study to both employ experimental and observational data. We use an endorsement experiment where we were able to randomize messages that were sent to respondents and randomize whether or not the message was backed by a government, an international NGO, a traditional leader, or a religious leader. We also paired the endorsement experiment with an observational study using both survey questions from before the pandemic broke out and after the pandemic broke out, where we were able to measure before and after levels of trust in various government actors. And then we also used two list experiments, not necessarily for results that we use in the study, but as ways to kind of rule out alternative explanations to ensure that that our study has to rule out some possible flaws or limitations in our study. And so our findings from this setup, if we go to the next slide, first I want to show you just some brief results from our endorsement experiment. So again, what we did here is that we sent text messages out to the respondents and we randomized whether or not the messages were coming from a government authority, an international NGO, religious leaders, or traditional leaders. And then we asked respondents their level of support for this specific policy that was endorsed by these actors. And so support for banning social gatherings or support for social distancing. And what we actually observed, even though these were very kind of like subtle text messages in a very noisy environment for many of these respondents, is that in the context of Uganda, messages were actually more effective coming from the government, especially related to religious leaders, and especially for things like banning social gatherings. And so the first thing that we want to highlight right off is that even in a kind of like non-democratic authoritarian context like Uganda, the government is still playing a key role in kind of shaping how people perceive what are appropriate messages and support for public health response. But that just kind of answers the first question, which is in the context of Uganda, it's the government that's the most effective at shaping these messages. But if we go to the next slide and study 2, what we wanted to do is actually look at what is the relationship between trust in government and kind of people's support for and like not just support for, but actual compliance with a number of public health restrictions. And so what we actually observe here is even if we use in the top panel, we have our baseline measures of trust. And so these are measures of citizens' trust in various actors before the pandemic outbreak. And we're able to correlate that with their levels of compliance with public health measures. And the bottom panel is the follow-up measures of trust. And again, we run the same analyses. We see that trust in government is essential in shaping, it's positively correlated and is very important in shaping people's compliance. And it's not just that it's trust in all actors, it's specifically trust in the government. It's not trust in the local level official, and it's not necessarily even trust in the community, but trust in the government is very important in shaping this. But we wanted to actually disaggregate what does trust in government actually mean, which actors are actually driving this relationship. And so what we did is we actually break down the trust measure, and we asked the respondents to actually rate their levels of trust in various actors, be it the central government or the state or the police or the Ministry of Health. And so the next slide actually shows the results for these individual actors when we disaggregate this. And what we see is that while trust in the central government is important, which certainly makes sense in a context like Uganda that has a very strong centralized state, what's also important is trust in the police. And so the way that people actually view the actors responsible for enforcing those regulations is very critical to whether or not they're going to comply. And we think that that's a really important thing to highlight in this study. Using the same setup where the top panel is our baseline measures of trust. So these are people's expressed levels of trust in these actors before the COVID outbreak. And then the bottom panel is their levels of trust during the COVID outbreak or the COVID pandemic. And we were able to include another question about trust in the Ministry of Health. And we actually trust in the Ministry of Health and trust in the police are very comparable, which shows that we really do need to start unpacking more the various links and layers, I think, along these 4 different stages. So it's not just about government in the whole, but thinking about the role of enforcement, thinking about the role of who's sharing the information, who's diagnosing the problem is critical. The next slide, please. So there are some perhaps concerns with directly asking respondents whether or not they're complying with public health restrictions. For example, there might be something like a social desirability bias where people are saying that they're complying even though they're not. And so we wanted to use some kind of more socially sensitive survey designs to kind of solicit more truthful answers from the respondents. And so in order to do that, we used two list experiments, which are survey tools that allow us to kind of solicit more truthful responses. And so we administered these two list experiments relating to whether like mask compliance and compliance on not attending religious services. And what we actually observed in our study is that the kind of more socially sensitive survey approach actually resulted in very similar answers than the direct questioning approach, which increases our confidence that we do feel like people are being honest in their responses. And we think that that's quite important. And so in short, social desirability bias is not driving our results, but there really is this relationship between trust in these various actors and their actual stated compliance with these public health concerns. Next slide, please. So our key takeaways, and I'm looking forward to Kate's talk because I think that she provides another lens to this discussion. But in our study, we show that messages from government officials generate stronger support for public health restrictions than other actors. Trust in government is crucial to garner that compliance. But the relationship between trust and compliance is especially strong for the police and the Ministry of Health. And so it's not just trust in the government writ large, but actually we need to really think about the relationship of who's handling what aspect of the crisis, and how do people view that actor and those actors responsible for that. So kind of some concluding discussions. On the next slide. Trust is, as Ricardo has highlighted so well in the introduction, is really important. It's especially important in the various government actors who are responsible for overseeing enforcement and sharing of information. We have found in our study that this shapes people's support for and compliance with public health regulations. And so we know that the way that citizens respond is critical to curbing the spread of the virus or of other pandemics. And so in thinking about ways to actually build that compliance and build support for taking those often very disruptive and very costly actions, we have to really think about how to build trust preemptively in many of these institutions. I would argue that domestic and international actors need to consider those tasks with handling the various stages of public health crises and the ongoing relationships to the community. In the context of Uganda, it might not have been best for the police to be handling enforcement given the amount of distrust that had already occurred in the country towards the police as an institution. And so really thinking through these relationships, that just because you have a tool available to handle enforcement, is it actually the best tool? And that might not always be the case. Citizens draw on pre-crisis reservoirs of trust in many of these actors, and trust in specific actors might improve compliance, but the flip side of that coin is that distrust in these actors can also undermine it, which I think is important for us to also consider and think through. But with that, thank you very much for your attention. I look forward to the discussion.
Great, thanks Travis. Thanks for that insightful session on the research carried out in relation to Uganda and building trust. So there's a couple of reflections, questions in the chat. So maybe going to Showband's one. So around did you disaggregate by subpopulations, so rural versus urban, income, education, and so forth?
We did, and we controlled for several of those characteristics in the study. And so we don't, I don't have those results here, but we did consider the way that we sampled, we had balance on kind of urban and we actually, in this specific study, we were actually oversampled on rural areas. And so we actually had more rural. So we weren't balanced on urban rural, but we were balanced on gender. And then we controlled for those various characteristics.
Did you find significant differences in results based on those characteristics?
We didn't. We did. In this specific study, we don't see variation in kind of levels of trust in shaping, like there's variation perhaps in like variation in compliance levels, but not in shaping the relationship between trust and compliance.
Great. Okay, thanks. So a question from Alejandra. Do you want to answer that question? So it's related to the differences not being significant. Want to speak to that question? Unmute yourself. I'm not sure if that person's still online, but yeah, so maybe any remarks there you want to make there, Travis? It's just a remark saying I'm not sure what differences they're suggesting are not significant. So any reflections on that?
I think this was from the first figure that you showed. That was when this comment popped up that talked about government versus religious and other community leaders.
It's true. So the coefficient, the intervals are actually overlapping on several of those results, and so we see a statistically significant difference between government and religious leaders, but we don't see a statistically significant differences for all of them. And so it is the case that across the board, the government has messages sent from the government. There's kind of there's more support expressed, but the confidence intervals do overlap. But they're statistically significant for the difference between government officials and religious leaders for the banning of gatherings.
Okay, great. Thanks, Travis. And a question from Sue Kin. So around, I'm not sure if you missed it, but in terms of how are you measuring the levels of trust? Is this based on what people are saying? So how did you actually measure?
This is a great question. So we just asked, this was translated into 13 different languages, and we asked people to basically on a 5-point scale to rate the levels of trust in these various actors. But that opens up, I think, a very important conversation that I'd love for us to be able to have, which is what does trust actually mean as a concept? And this is something that my co-authors and I've actually wrestled with back and forth. Is it viewing an institution that is like, we trust them because they're effective at their job, or do we trust them because they're legitimate to do their job? That I'm not sure that our measures actually answer that question. And so what I'd love to see is what conceptually, kind of at an academic level, do we mean by trust, and what do individuals themselves mean when they are responding to, when we ask them, do you trust these institutions? Very little, or quite a lot. What does that variation mean? And I think that that's important to move forward. But this was just individuals' response to questions about their levels of trust based on a 5-point scale.
Great, thanks, Trevor. I mean, that goes on to a good answer to the segue to the next question, and then we'll pass over to Kate. So a question from Kate is, did your study look at what measures helped increase trust? So did the study look at ways in which of increasing and soliciting that trust in the case in the short term?
This study did not, but I think that one of the challenges is that the study that this is built on for the infrastructure was actually this 2-year-long community policing study that was actually in the field trying to study various ways that the police could actually build or foster more trust with citizens. And so specifically looking at police, there were different ways of perhaps more community policing initiatives, and so having more kind of police spending more time with community members, having more time sharing information back and forth with the citizens. And the results of that initial study shows that it's actually extremely difficult to actually improve trust in many of these institutions. And I'm not a part of that study, but I've actually studied how actions done by the police and other actors undermine trust. And what I actually what I have observed from my studies, speaking to the community policing study, is that for many of these actors, it's actually much more easy to undermine trust in many of these institutions. That when the police engage in perhaps political violence, or when they engage in some type of abuse, it actually leads citizens to distrust them in their policing functions. And it actually takes a whole lot of work to kind of rebuild that reservoir of trust. And I don't think that that's just the case for the police, but we can also look at the Ministry of Health and other government actors, is that for many actors, when they make a mistake or when they do something wrong or they get a call wrong, it can actually foster like distrust in them as an institution. And it takes a lot of work to actually kind of rebuild those reservoirs of trust. But in this specific study, we don't actually look at the various ways that we could actually try to build that trust. But thank you for those questions.
Great, thanks so much for the questions. Really organic amount of questions there. So I'm going to thank you, Travis, for your informative session there. I'm going to pass over to Kate now, so to give us context of research carried out in Pakistan. So over to you, Kate. Thank you.
Thank you so much for having me, and thanks, Travis, for a very interesting talk. And I think that the two fit together really well. So I'm going to be talking about a study that we conducted in collaboration with the Center for Economic Research in Pakistan here in Lahore. Next slide. So the motivation for this study is that we know from quite a wide body of research in economics, political science, public health, and other fields that religious institutions and religious leaders can have a major influence on people's life decisions, and either reinforce state guidance or challenge it when it comes to deciding, for example, about engaging in violence, how to vote, or in this case, deciding about whether or not to comply with public health guidance. So we know they're important, but to take this to policy, it would be helpful to understand, is it possible to influence them, the religious leaders themselves? We don't know a whole lot about what influences the decisions of religious leaders. And so in this study, what we're doing is to look at whether or not simple engagement to reach out to local religious leaders can convince them to instruct congregants to comply with public health measures in the mosque in the context of COVID-19. Next slide. So we're looking at the context of religious gatherings in Pakistan. Pakistan is a vast majority Muslims, over 97%, and in the kind of traditional interpretation, Friday prayer in congregation, so attending at the mosque, is a religious obligation. Most Muslim men would consider it as such. Not just that, but it's considered the sunnah, the example of the Prophet, to stand shoulder to shoulder while praying in Friday prayer. So this is obviously, in the context of COVID, a prime kind of environment for transmission, and that itself kind of set up a potential conflict between religious values and complying with these values and public health guidance during the pandemic. The other important piece of information to keep in mind is that, as you might expect, imams or Islamic religious leaders often play a really important leadership role in the community, such that they can have influence on people's decisions, just like in the generic cases that I talked about in the first slide. Next slide. So as the COVID-19 pandemic started to happen, the government wanted to restrict religious gatherings in order to reduce the potential for transmission, and to put a number of restrictions on mosques. This resulted in some pretty big clashes between religious leaders and the state, and eventually the government sat down with a number of kind of senior national level religious leaders and hammered out a 20-point plan, which said, okay, you can stay open, but you have to follow a 20-point plan, which included a number of kind of key things, including hygiene in the mosque, restrictions on the elderly attending prayer, distancing between people during congregational prayer, which, as I mentioned, is not normally the way that it's done, and is considered kind of not a desirable way to do it. Doing the traditional ablutions or wuzu at home instead of in the mosque, as you might normally, and most critically, as we know, I think now, wearing face masks during the congregational prayer. Next slide. So you can see that in the two images that the compliance with these measures was really mixed. So there are some mosques, a number of NGOs kind of did spot checks on what was going on in terms of these new rules. And in most of the mosques that they visited, there were, as you can see in the top picture, they were just being pretty much ignored. In the second picture that you can see here, there's compliance with some, but not all of the regulations. So you can see in the second picture, the people have spaced out, and some of them, but not all of them, are wearing face masks. Next slide. So what we did to kind of understand if there's scope for improving this at the community level, we carried out a phone-based study during the kind of quite a peak period of the pandemic. We carried out phone calls to a sample of 1,500 imams or local religious leaders from community mosques across both urban and rural areas of the province of Punjab, which is the most populous province in Pakistan. Next. We found we seek a number of kind of key things in our survey, in our baseline survey questionnaire. And so one thing to point out here is that most of them are already receiving frequent messages about COVID and COVID compliance. Next slide. And the majority of them already know the basics about COVID transmission, which should be applicable when they think about what's going to happen when they lead prayer every day, well, 5 times a day, but especially on Fridays when it's considered obligatory. So most of the imams already knew that COVID can be spread by people who don't look sick, and COVID can be spread by coughing or sneezing, even if you don't touch another person. So the transmission through the air in the mosque. Next slide. So the question is, since they know these things, why is the compliance with these rules, especially with regard to face masks, so low? So what we do to try to understand this is we carry out a randomized control trial in which we randomize imams in this group of 1,500 into different treatment arms. So we've got everyone who's in any treatment arm, as opposed to the control, gets health information, so basic information on COVID asymptomatic spread and how it can occur at the mosque. So, it can pass from person to person while they're coming in to pray, even if they don't touch each other. Secondly, all of the treatment arms got a messaging that emphasized the importance of their role as leaders in the community and their role in protecting vulnerable members of the community from COVID. And thirdly, they all received kind of emphasis on the key actionable points from that 20-point plan. So not all the 20 points are very clearly actionable, but there's 5 or 6 that are really central, including masking. And we asked them to kind of commit in this interactive script we asked them to commit to spreading the word to their community and kind of passing this message on to their congregants, and asked them if they're willing to do so. Next slide. So that happens with all of the treatment group participants. In addition to that, we have an arm in which we do everything I just said, plus we add religious content. So we mention religious leadership at the international and national level that have endorsed the protocols, as well as going back to kind of the original sources, saying hadith or sayings of the Prophet regarding spreading the plague and the responsibility of the community to take measures to avoid spreading disease and as well as protect the vulnerable. And finally, examples from other Muslim countries that are following strong measures to prevent COVID spread. Next slide. So how do we then see, given that we were under lockdown, how do we then see whether this actually had any impact? Well, we didn't want to just survey people again to ask what they were doing, because we were concerned that would result in a lot of response bias. You tell somebody to do something and then ask them if they did, then they're more likely to say they did, even if you didn't shift their behavior. So what we do instead is we use mystery shoppers. For those in the public health field, I think standardized patient type of a method might be something that's a little bit more familiar. But the idea is that an enumerator, another enumerator, not the same person who called the first time, calls at another time to say, I'm a member of the community. I'd like to know when are the Eid prayers happening? what time is the service, and to see whether the imam advises on these points. So, do I have to wear a mask? Yes or no? Oh, I don't really want to wear a mask. Do I really have to? And so forth. So we think that these calls were credible to imams, and they didn't think that they were enumerators calling. In fact, quite a lot of the imams actually called back to let our mystery shopper callers know when they had finalized the time for the service, which presumably they wouldn't do if they thought that it was a survey call. So, so in general, this was a very quick call just to confirm, which is a typical thing that people in the community might do, because the Eid prayers are not, their timing is generally fixed shortly beforehand. And we are able to then detect kind of what is it that they're advising congregants without that kind of survey response bias. Next slide. If you can just hit next until we have the whole table here. So we've got this design is going to allow us to look at the impact of persuasion, secular persuasion, and also to test whether additional religious content of the persuasion makes a bigger impact on convincing these local religious leaders. We also have an additional arm, a super control, in which we just do a baseline survey. So we test whether the baseline survey by itself might be influencing how people behave, and we kind of rule that out. Next slide. All of this takes place in August 2020, in the weeks before the Eid al-Adha holiday, which is when this kind of big huge religious gathering happens on Eid prayers. Next slide. So what do we find? Well, in the control group, between a third and a half of imams instructed the mystery shopper to take counter-COVID measures when attending prayers. And so in particular, I'm going to focus on the masking here, because we now know that that's out of everything that was being advised by the government at that time, that seems like the most public health relevant outcome. And we see that about almost 40% recommended a mask, and under 30% said the mask was required in the control group who hadn't received any such persuasion. Next slide. What we find is that the persuasion overall was effective in convincing the imams, these local religious leaders, to change what they advise to their congregants. So it increases the probability that they instruct the congregant to mask by 25% over the control group mean. Next slide. We were somewhat surprised to see that there's no additional benefit from adding religious content. The difference between these second two bars is not significant, but if anything, the means the mean was slightly higher in the secular treatment arm, despite like a very extensive kind of workshopping and development of religious content that should be relevant to kind of all participants, regardless of specific subsects. Next slide. Another kind of key finding from this study is that the effect doesn't seem to run through providing people new information about COVID transmission. So the effects are really driven by people who already knew about COVID transmission at baseline. And what we think is happening is that it's kind of activating their sense of responsibility to act on that information by engaging them and thinking about how does this play a role in your, how does this information apply to your role as a local religious leader? Next slide. So to kind of sum up, what we find is that simple one-on-one persuasion with a pro-social focus that kind of encourages these local religious leaders to think about their responsibility in their community and how these government guidelines apply to their role in protecting the vulnerable in their community significantly improves the advice that they give to congregants on what they should do when they attend the mosque. Both of the treatments are effective at increasing these outcomes, and explicitly religious messaging turned out not to be necessary. The treatment doesn't seem to work through just providing basic information about COVID. As I showed, most people already kind of knew a lot of those basics. What seems to be happening is that connecting it to their leadership role may be more important. Next slide. So just to think a little bit about kind of how this applies to policy, as I mentioned at the beginning, we know from a lot of other studies that religious leaders in many settings influence important life decisions, including health decisions. And what we've shown here is that simple, very low-cost outreach interactive outreach can lead local religious leaders to engage productively with state guidelines, even in a context where there's a lot of tension around this. But it's not really happening on a large scale. I wanted to mention as a side note that there's potential for, outside of the field of health, there's also potential for productive engagement with these kinds of leaders in many areas of social and behavioral change. We have another study looking at a training that was carried out by the Commission on the Status of Women on women's rights in marriage, which changes what happens when these guys conduct marriage ceremonies. And we again find that can be quite effective, but nobody's really talking to them about any of this stuff. And I think I've been reflecting about why is that, and it's quite hard to even figure out like who are the right policymakers to talk to about scaling up this kind of an intervention. And I think a part of the issue here is that no ministry has a mandate for this. The health ministry doesn't have a mandate to talk to religious leaders about health, and the Ministry of Religious Affairs, which does exist here in Pakistan, doesn't have a mandate to talk to them about health. So it raises, I think, an interesting question about what scope there might be for institutional change that could help, these sorts of areas where there's clearly a lot of potential for making the public health or social kind of interventions by the state more effective, but that don't really fall in anybody's area of responsibility. And that's it. Thank you so much for your time, and looking forward to any questions and comments. And sorry, I should have said thank you for the acknowledgement slide. So thanks to a fantastic team at SERP who I work with on this research, and very gratefully acknowledging funding support from IGC and IPA and the prime funder FCDO.
Brilliant. Thank you, Kate. So maybe just stop sharing the slides. That's the sort of annex that Kate shared with us as well. So if you stop sharing the slides, that's great. So thank you, Kate. That was fascinating presentation and findings that you synthesized there from the Pakistan experience. So is there any questions or reflections for Kate before we open up to a more generic discussion?
I see one in the chat, which is asking something I failed to mention in this short version of the slide deck, which is who do they think is calling? I should have said that, sorry. So the initial call, the persuasive call, the enumerator identified himself as calling from the think tank. He wasn't representing the government, but he mentioned which parts of the advice was government advice and which part, and said, the survey questions are from this think tank. Now I'm going to tell you about the government advice. And the mystery shopper call was mocked as a community member. So it's a very short, 5 minutes. By the way, what time is the prayer? And I'm planning to come. And do I have to wear a mask? So in that case, the respondent is supposed to think that it's somebody in the community.
Great, thanks. Does that answer your question,
Thank you.
Jonathan? Yeah.
Yeah,
okay,
that's great. Thanks. So it's sort of, I guess, the thing that there with trust is saying something about the trust in this think tank, isn't it? And that's another thing you could explore with further work, is changing who they think is calling, I guess.
Yes, yeah. We kind of thought about different ways of approaching this, but I think, for ethical reasons, we needed to kind of identify ourselves as such. But I think that's what we've tried to be, like, the emphasis in the script is very much on the specific sources that are being cited. So for the government guideline, we talk about the fact that it's a government guideline and which government agencies were involved. And for the religious guidelines, then we're really emphasizing on the religious sources. So some of those are scriptural sources, as I mentioned, and others are specific contemporary religious leaders, both nationally and internationally. So in that sense, I guess the way we were thinking about it as a script kind of emphasizes more on the trust in those different, the government and secular and religious sources that we cite. But of course, as you say, engagement in the survey requires that they're willing to at least hear something from the think tank as well.
Great, thanks, Jonathan. Thanks, Kate. So we've got a question from Georgia Plank. Do you want to go ahead?
Hi, thanks, Kate. This is really super interesting. I was just wondering on your sort of concluding point around, this potential for productive engagement with religious leaders or other areas of behavioural change. I just wondered if you've come across anything or any other studies that are taking this kind of approach, looking at how we influence religious or community leaders, but perhaps in other areas, just if you happen to be aware. Thanks.
Yeah, as far as religious leaders, I think when we were looking at the literature, we found very little, except for these two studies, like the one I presented today and the other one I mentioned. There is a lot more on influences of community leaders in different kind of contexts. So I can share more offline if that might be of interest.
Okay, thank you. That's helpful.
Great, thanks, Georgia. Thanks, Kate. So maybe just an open question for the group, everyone that's listening today. So a couple of questions in the chat there, but also on the screen would be, so how do you develop and maintain? So that develop, but moreover, the maintenance of public trust during a disease outbreak. Another question to throw out there maybe for the group would be what successes and challenges you've encountered, and what learnings can we extrapolate for future policies and programming during future disease outbreaks? So any reflections from anyone? I might start off, would be, for me, my takeaway, having seen different outbreaks, would be transparency. So making sure you really are clear and concise, but moreover, showcase the unknowns and the knowns, so being open with that. So COVID did catch us off guard. So there was different countries who were quite honest about what they didn't know and did know. So I think that's really, really important going forward. Any reflections from anyone else? In those three questions, they're in the chat, but also on the screen. Feel free to unmute yourself. Everyone's tummy's rumbling in the UK. It's lunchtime, so I'm wondering whether people are jet setting off to other places. Any reflections from the speakers, or Ricardo, or Fatima, or Pippa?
Jenny, I was just thinking about your comment about transparency, and just our study, we fielded it very early on in the pandemic, and we even had to change language because we used things like the peak of the pandemic, and then we had to step back and acknowledge just again, like, that we still have so much that we don't know, and that there is still just uncertainty about. There's language about that we're in a post-COVID pandemic environment, but we're not in a post-pandemic. Like, there's still so much that we still don't know about COVID, and just how time and transparency often interact with, at first, perhaps leaders want to put on a strong face to look authoritative, that we understand everything and we want to be sure, so that there will be support, so that there will be confidence, so there will be trust. But sometimes that can undermine their legitimacy if they do get it wrong. And so just that back and forth of how do various institutions try to both act with confidence that we know what we're doing, while still being humble with it, but we might get it wrong. And you might not be able to spend your holidays without masks. So you might not have the kids go back to school, or because I think that one of the things in Uganda and elsewhere is just that people might be willing to comply in the short term. So sure, we'll wear masks, so we'll social distance, so we won't go to gatherings. But as time goes on, these become increasingly just even more disruptive to their day-to-day lives. And so just how do you continue to address those challenges, I think is hard.
Yeah. And
I've just dropped a link in the chat of a paper that I think speaks a little bit to this point about, what's should a state or a public health authority, how to what extent does this kind of perception of inconsistency, like today it's one thing, tomorrow it's another, that can kind of undermine people's willingness to listen and comply in the future. So
yeah, no, 100%. So there's quite a few things. So Pippa, you're great. Do you want to highlight what you've conveyed in the chat there, Pippa, before we close off?
Yeah, I mean, it's just really helpful because we're thinking about pandemic preparedness at the moment, and some of those things that could be falling through the gap, but are really simple and effective that we've learned, to just make sure that we're thinking about that and addressing that while we have the time and headspace to do that, potentially in preparing for other things in the future.
Yeah. And as Siobhan rightfully said, you know, that fatigue element, so that maintenance of public trust, how do you overcome those such challenges, whilst also keeping abreast of the issues at stake, you know, how the pandemic or outbreak that you're responding to changes and emerges. Right, I'm conscious of time, so we're a couple minutes over time. I think really huge thanks to all the speakers. So Ricardo, thank you so much for bringing these great researchers and speakers. So Kate and Travis, thank you. And all the attendees, thank you so much for your time and energy for coming to the session today. And yeah, do reach out to us if you need anything. And there's the COVID-19 behaviour change forum that we you know, routinely meet for a sort of half-hour deep dive sort of session on such meaty subjects to discuss. So thank you everyone, and wishing you well for the 2023. And yeah, keep well everyone, and talk to you soon. So thank you all.
Thank you so
Thanks.
much.
Thanks everyone. Round of applause. Thank you,
Thank
Travis.
you,
Thank you,
everyone.
Ricardo and Kate. Thank you.
And thank you, Jenny.
Thank you.
Thank you, everyone. This is brilliant. Thanks.
Thank you, everyone. Thank you so much, Jenny.